So as you might imagine, our hospitals and health systems are under a tremendous strain as it relates to providing care for this COVID-19 population and the communities that are at risk for COVID-19. And we have been working very hard at the association in order to provide our members with relief and assistance to problem solve around many of the situational challenges that they faced during the early days of the pandemic. And one of those, it was the potential for there to be a real shortage of ventilator equipment as patients came into the hospital and required intensive care unit services, including ventilation, artificial ventilation. So the early forecast models were that many of our larger hospitals would be completely overrun with ICU level care needed, and that their ventilator inventory would not be sufficient to meet the need. And so the American Hospital Association was working on a model to try to help our members address this challenge about the same time that the White House and its task force on COVID-19 identified this as a real potential problem as well. And so when the White House called the association and asked what we were thinking about this potential problem, it was a real opportunity for us to work together. And we formed what I think is a very creative public-private partnership that has helped to address the potential of having a shortage of this very critical resource, high-cost resource, and oftentimes very limited resource. So what happened was that the association, we reached out to a number of our members, and we represent about 5,000 plus of the hospitals across the country. And we received very strong support from our members that forming some sort of a virtual inventory of this vital equipment would be of value to them. And we enrolled in what we call phase one of this program, 24 hospitals and healthcare systems across the country, representing sites in all 50 of our states and 2 of our territories. And when you count the number of hospitals that these 24 health systems represent, it's about 990 individual hospitals that are now participating in this program. What we've been able to do is through a software platform, we've been able to build a virtual database of ventilator equipment by specification so that an individual hospital that might be predicting a surge of care requirements that outstrips their ability to utilize their own equipment could go to this virtual inventory and identify ventilation equipment that would be matching to what their particular staff have been trained on and what they're familiar with, and we would then be able to transport equipment between individual hospitals and fulfill that very critical need. We have right now today over 3,000 pieces of equipment in the virtual inventory. We've successfully tested the logistics portion of this model and have moved equipment between individual hospitals.